Good morning. My name is Wilson Ramos and I'm going to talk about brain metastasis. Definition. Brain metastasis occurs when cancer cells spread from their original location to the brain, but those most likely to cause brain metastases are lung cancer, breast cancer, colon cancer, kidney cancer, and melanoma.
Brain metastases. In this whiteboard video of our Oncology Emergency series, we will discuss an overview of brain metastases. A detailed written module and virtual patient case are available on learnoncology.ca. You may wish to open this and follow along with them. By the end of this video, you should understand the following objectives. Pause the video now to review them. Brain metastases occur in 10 to 30% of cancer patients. They are most common in patients with lung cancer, renal cell carcinoma, melanoma, breast cancer, and colorectal cancer. Tumor cells metastasize to the brain by hematogenous spread through blood vessels. They usually become lodged at the gray matter-white matter junction, where the blood vessels abruptly decrease in size. As a result, brain metastases are often found at this junction. The distribution of brain metastases in the brain roughly corresponds with the amount of blood flow received by that part of the brain, with roughly 80% going to the cerebral hemispheres, 15% going to the cerebellum, and 5% going to the brainstem. Brain metastases mainly cause symptoms from the direct effect of the mass, as well as from the edema surrounding the mass. The tumor and its surrounding edema can lead to increased intracranial pressure. Patients with brain metastases may present with headache, focal weakness, altered mental status, seizures, ataxia, and stroke, as well as complications of increased intracranial pressure, such as brain herniation. Up to 1/3 of patients with brain metastases are asymptomatic. In a patient with suspected brain metastases, the diagnostic approach includes a history and physical exam, including a neurological examination, brain imaging, and a biopsy if the diagnosis is unclear. For example, in a patient complaining of a headache, one should ask about whether this is a change in their usual headache pattern, any associated nausea and vomiting or other symptoms, and any factors that make the headache worse, such as position, coughing, sneezing, and straining. The classical brain tumor headache is described as being worse in the morning on awakening. It should be noted that this is not common, but strongly suggests a brain tumor when it is present. The physical exam should include a neurological examination to look for any neurological deficits, as well as an examination of the fundi for papilledema. One should also perform a full physical examination to assess the primary tumor if known and look for any other metastases. Contrast-enhanced MRI is the preferred imaging test, as it is more sensitive than CT or non-enhanced MRI for detecting brain metastases and distinguishing them from other lesions. But CT may be more readily available and is a reasonable first step. Finally, biopsy should be performed if the diagnosis is still uncertain, for instance, in patients with no known cancer diagnosis or a very long disease-free interval with no other metastasis.
Application in medicine. Radiotherapy is one of the mainstays of the treatment of all of oncological patients. The side field of administration of radiation includes the tumoral volume, the lymph nodes that drain the area to the healthy tissues adjacent to the tumor. For this reason, the effects of radiotherapy also appear in healthy tissues and are more marked in those with a high cell tumor rate, such as the oral, pharyngeal, and laryngeal mucous and bone marrow. Brain metastasis is severe because it up the intracranial pressure and should become a cerebral stroke. Pros and cons. Pros. The treatment options for people with brain metastases include medication, surgery, stereotactic radiosurgery, whole brain radiation therapy, or mixture of these. In certain situations, the treatment may consider drug treatment for brain metastases. Cons. As metastatic brain tumors increase in size, they put pressure on the surrounding brain tissue and change its function. This causing signs of headache, personality change, memory loss, and seizures.
Brain metastasis is a diagnosis that is becoming more and more common, particularly because patients are living longer and longer with cancer diagnoses. In the United States, approximately 200,000 patients are diagnosed with brain metastasis. These are cancers that originate from a different part of the body. For example, lung cancer is the most common, and it ends up depositing a small focus of disease within the brain itself. Now, these can lead to very concerning clinical consequences depending on the location of where the brain tumor shows up. For example, some parts of the brain will represent areas where seizures could form, other parts can cause weakness. For patients diagnosed with brain metastasis, it is important to seek care at a center like Mayo Clinic, particularly because we are able to offer the entire catalog of different treatment options for that patient.
Everything has to be taken into consideration so that when we look at a patient, it isn't looking specifically at how many brain metastases do they have, or where are those brain metastases located, or how many treatments have they had. It has to do with the whole picture of that individual patient. What options they have for future treatment for their systemic disease should also factor into the decisions for how we manage their brain metastases.
In case of brain metastases, the sooner the patient sees the specialist, the better. The treatment options vary, again, depending on the number of the lesions, the number of metastases, the size of the metastases, where they are in the brain. So it all depends on when in the course we catch them. But the general rule is the sooner you can see a physician, the better. And again, at a place where multi-specialty approach is available.
Diagnostic options for patients with brain metastases, there's so many. Imaging is very, very important. How can we get at the diagnosis without having to expose the patient to a scalpel or a needle? So I think that we have cutting-edge imaging tools here, MRI, PET scans, spectroscopy, and other technologies as well. But also, it's one thing to have technology, but you need the people who know how to interpret that technology.
Nowadays, given the development of technology, we are able to treat smaller lesions in a very localized sort of a pinpoint fashion, so that spares the rest of the brain. So we are striving to do that.
Mayo Clinic has tremendous expertise in treating patients with metastatic brain tumors. The treatments available for metastatic brain tumor vary from surgery to radiation to newer drugs that penetrate the blood-brain barrier in order to get to the brain.
It's really a combination of treatments that is important for the patients to be able to receive effectively. For patients with metastatic disease, there's no one right answer. It really requires a collaborative team effort in seeing the patient with this metastatic disease. For example, in the surgical realm, there are advances in surgical techniques enabled to taking out metastatic disease safely. For medical therapy, there are a number of newer agents, such as immunotherapies, that allows treatment of metastatic disease to the brain. Within radiation oncology, we've advanced the technology where we can offer patients state-of-the-art radiosurgical techniques, proton beam therapy techniques, and more conventionally fractionated stereotactic techniques.
Issues applies in Ecuador. Retrospective study carried out the Solon Espinosa Ayala Hospital Solca in Quito. Patients with brain metastases treated with holotherapy radiotherapy in the period from January 2003 to December 2018 were registered. For survival analysis, Kaplan-Meier curves and significance of difference with the long-rank test were used with a 5% type I or alpha error. Conclusions. Brain metastasis occurs when cancer begins in another part of the body and spreads to the brain, especially lymph nodes. Brain metastasis is a big deal in the field of treatment because it has changed to affect significantly the patient. Thank you.